So there's a lot of variables that go into this question, but we get we get asked this a lot, is how long before I can go back to work after the surgery. And so I did want to talk about some of the things that we typically talk about with patients when trying to discuss that. What we typically recommend is waiting about a week. Like if a patient has a surgery on like a Tuesday, it's like you probably go back to work on Monday. Same with like a Wednesday, you go back to work that next Monday. But that's like a very general blanket statement. Again, I think a lot of our patients feel great really quickly after the surgery, and they get their teeth the next day and they're looking and feeling really, really good. The one thing I will say is a lot of it really just depends on what you do for work. And so that's why we typically ask patients, like, is your work, is it very customer facing? Does it involve a lot of talking and being in front of people? And I think if that's the case, then I would recommend doing the recommended time. We also have patients where they're a truck driver and they spend all day driving and they don't talk to people. They're not in front of people. Honestly, you go back to work really, really quickly after that. We don't typically prescribe, because patients don't need it, very heavy pain medications, going back and forth between Tylenol and ibuprofen, and you're able to drive with that. So that would be one example. Another one would be just, again, a non-customer facing job. Like if you work behind a desk, you could go back to work pretty quickly. So yeah, I think there are some variables that go into it, but what I will say is we are always really surprised with how well patients do immediately after surgery. To be completely honest, I feel like patients have a harder time healing from like wisdom teeth extractions than they do with this All-on-X procedure. So again, it's best to come in and talk with the doctor, because some of it is also based off, your age and medical history, that kind of stuff. How well you can heal that way is that's also important in terms of factors to consider there. But as far as going back to work, those are some of the main things that I would consider, is just how involved are you in talking with customers or talking with people with your job, and are you very customer facing? Are you like lifting things? Like, are you a warehouse worker that's lifting heavy things? Those are all things that you might want to err more on the general recommendation of just waiting about a week. But if not, then you can go back to work really, really quickly. So just hopefully that helps a little bit.